Good morning, Facebook crowd. It's Jillian with Jilly Juice Mentality. And so I want to focus on the hospital units, doctors, inpatient, outpatient, whatever. Um, if you want to see a connection between what you were taught as a child and why people are on ventilators, it's because people have been using the medical holistic system to take over their bodily functions to where they get exposed to a new virus in the environment. It brings up different antibodies, thickens the blood. Low sodium diets cannot activate or carry all of that stuff out of the body or break up the thickening, and so then a person is relegated to go to the doctors because they have an infection. They have so much mucus and so much blood coagulating and agglutinating that they can't breathe, or they can't get their blood to move through vital organs, or they feel something, or they have a heart attack or a stroke or an aneurysm. And so you want to see the connection between what you were raised with and then being on a ventilator. It's because you're allowing the medical holistic system to take over your bodily functions. So I have to make some real distinctions here, because it's very easy to be like, oh, you're so against doctors, Jillian, and you're bashing the nurses and you're bashing the doctors. You don't want to talk to anyone that's in those fields, da da da. And here's the thing, I've always said triage. Triage, hey, if you're in an accident that's out of your control and you're unconscious, then, obviously you have no choice but to accept whatever help that comes your way. You just have no choice because you're unconscious, okay? So when you're unconscious, you're going to take whatever Good Samaritan or whatever protocol is out there that if that society deems life precious, they will keep you alive through triage out in the field or in a surgical room. I can't help that. Neither can the unconscious person help that. But if you're conscious, okay, maybe you'll opt to get some operation if you're like getting the jaws of life pulled off of you because of an accident that was not your fault. You weren't under the influence. You weren't having a seizure from all of your different pills, powders, and supplements. And it was something way out of the blue, out of your control that you couldn't even anticipate. Not say that someone in the opposite situation wouldn't deserve or would be faulted for taking on the medical stuff, but I can understand in accidents that are not your fault at all that, you make that choice to do that. And so, yes, trauma patients, obviously you need doctors for that, for triage trauma. And then there's the burn unit. I get the burn unit. Okay, you have to do what you got to do, okay, with the burn unit. But then the field triage then borders onto then plastic surgery. It then borders onto experimentation. It then borders onto therapy. And so there is a fine line between triage getting you stabilized and then you go home and figure out, what do you want to do? Do you want to just be in a cured state of where you're just in this, state of disability and decline? Or are you going to go home and do what you got to do, feed your body so the cells can regenerate, so you don't have to be, you don't have to experience every single day the modifications from that accident, that your body can morph back to what it was before the accident, right? And you're like, what the hell, Jillian? But no, that's the intention of the whole Jilly Juice mentality and feeding your body and pain. Okay, but no, some people will opt to go and do the skin grafts, do the plastic surgery, do all the shortcuts because they want to get back into the game that much quicker, and it makes heroes out of the doctors. And so there is that fine line between a hero of a doctor that saves someone's life out there in the field to a doctor that then does experimentation, and when it's successful, they're a hero, but they don't really talk about the unsuccessful patients. So it's like, so I want to make sure I clarify this because I could see someone like, wow, Jillian, then I hope you don't get an accident because you better hope that those doctors save your life, man. I'm like, okay, whatever. But anyways, so yeah, so when you look at the actual hospital, the makeup of a hospital, you'll see like the ear, nose, and throat, the doctor, all the different units in the hospital are all taking over your bodily functions for you. So let's just put the hospitals and the doctors in perspective. They're actually taking over your bodily functions for you. But in reality, it's the first and second lines of defense that they're taking over. So that way, when you are exposed to a variant of a virus and you experience agglutination in your mucus and in your blood, guess what? They have the IV bags of the saline, the salt, and the glucose to break it all up and stabilize you. Okay? They have all the bypass surgeries and the stents and the screws and all that stuff to modify your body, to open up the blood vessels. Oh, they'll give you some vasodilators and vasoconstrictors. You know, they'll give you blood thinners and pills. They'll give you antidiuretic pills or water pills. I mean, it's endless. How many products and services they have to take over your bodily functions for you. And so, yeah, when you take your kid to an ear, nose, and throat, or or anything, you give a kid Theraflu or any of these things out there that stop the mucus, plug it up, or you go and get them all, what do you call it? Removing fluids from their body, or removing mucus from their body. You're not training that child to be able to expel on their own. So that's why with the J juice, yes, it bypasses the first lines of defense because you haven't been exposed. But then here's the thing. You are opening up retroactive evolution, so you're going to feel the pain, right? You're going to feel stuff. And then at some point, when you finally reach a plateau with the J juice, whatever that is, and don't be doing J juice forever, because then you could be in a cured state. So at some point, you don't want to plateau. You just want to know that you've opened up the retroactive gates of evolution. Now you deal with everything. You feed your body with food, get the poop out without always doing waterfalls, and then you will start evolving to the environment, okay? Because you don't want to be in a cured state, because there's that side of it. And so I noticed that the Chicago Tribune and the New York Times is attacking Joseph Mercola. I didn't read the article, but the little headlines was talking about how they were, that Mercola was one of the biggest misinfo influencers out there. And, I would have to agree, but he also is in the same lines of the doctors. It's disappearing symptoms. It's suppressing symptoms. Even though he's anti-vector therapeutic, why is he anti-vector therapeutic? Not because he wants you to be independent and work on your own. No, he's anti-vector therapeutic because he doesn't want to feel the pain. But you're going to feel the pain from the virus anyways. But if him and Aaron's modus operandi is to suppress symptoms and to use, hormone replacement therapy with supplements, then how is he and her any different than some doctor in those ivory towers of a hospital? But they deem themselves different. You know why? Because they have a different way of selling the same thing with the same intention. And then, and so then now they're the sacrificial lambs with the anti-vector campaign, which really, if your intention of being anti-vector is because you're afraid of the symptoms, then, don't even bother being anti-vector, because you might as well just get the virus you might as well just get the virus and deal with it. And maybe you'll handle it, maybe you won't. But then you get the vector and you feel symptoms. It's no different. You drink some J juice and open up the ionic gates. So being anti-vector at this point, especially if you understand J juice, is kind of stupid. I could see why you'd be anti-vector out there in the medical holistic industry, because you're afraid of symptoms. But their whole premise is to lessen the symptoms. Their whole premise is to put you in a cured state. Though people have issue with that, they're like, well, not really. It says in the inserts that this could potentially happen. See, so there's a lot of weird psychological stuff going on. There's a lot of complicated stuff because we're looking at balance. And we're now teaching people that symptoms are not something to be afraid of. But that's what they've taught you in the medical holistic industry, energy healing world, is that symptoms are something to be afraid of. Evolution is to be squelched. No one lives forever. That's what they're saying. And so, of course, all their protocols are going to be in line with that nobody lives forever. And so, yes, when you are suppressing evolution, when you are mitigating symptoms, and you're taking your pills and your powders and your supplements and your detoxes, and even J juice in reaction to, because you don't want to deal with evolution, you're not going to live indefinitely. There's no fucking way, of course. They are a self-fulfilling prophecy. And so here's the thing. If you want to know the pathway to being on a ventilator, it's teaching your kid that they can't expel on their own. It's teaching your kids that they have to turn to the medical holistic industry to take over their main bodily functions. Their most basic bodily functions, like expelling or stopping it. One of the two. All right, bye.